And that's because something great is happening during this season. It's a season of giveaways, and the Lagos State government through LASHMA is doing a whole lot of that. So we're talking universal health coverage for Lagosians, ILERA EKO to the rescue. And my guest this morning is Olukayode Ogunbayo, who is sales manager for the Lagos State Health Management Agency, LASHMA. Nice to have you in the building, Ogunbayo. Good morning.
Good morning, sir.
How are you doing?
I'm very good, sir.
Great. So the Lagos State Health Management Agency, LASHMA, of course, is very much in charge of the health insurance program in Lagos. So let's just take some little time to explain the concept of health insurance to our people, Mr. Ogunbayo. What is health insurance?
Good morning, Lagos. Good morning, listeners. Health insurance is a scheme that is established and passed into law to give people affordable access care at the hospital,
right,
without paying a dime after the initial premium has been paid.
Okay. So to say that once you have that initial premium paid, then you're going to be getting health coverage.
Yes.
And what does LASHMA? So LASHMA is the agency that is mandated to do that, right?
Yes.
Talk to us about your mandate a bit.
Well, in 2015, the Lagos State House of Assembly passed into law that all Lagos residents must belong to health insurance, and that is the mandate of Lagos State government. We want to thank the initiative of the governor, Mr. Babajide Olushola Sanwo-Olu, for this good initiative. Because when it was passed to law, it did not kick off immediately. It was during its tenure that the Lagos State Health Insurance Scheme actually kicked off through the Lagos State Health Management Agency, and we have the mandate that all Lagos residents, not Lagosians in particular now, all Lagos residents must key in to a health insurance plan.
Right.
And of course, we know the population of Lagos residents. But at the moment, we have started an initiative with partnership with Office of Civic Engagement, to go around all the local governments in Lagos State to do what we term grassroots sensitization. As I speak to you now, we've been to 11 local governments in Lagos,
right,
left with 9.
Okay, so you guys are embarking on this massive campaign to see how people can key into it. And what has been the response so far so good since this initiative has been in existence?
The response has been encouraging and massive. And you know, like we said, we have also introduced the ILERA EKO promotions and rewards. That is the one we tag the ILERA EKO Mega Promo,
right,
which has also been introduced to them.
Very good. So we'll talk to that, but we'll come to that very, very soon. But the concept of ILERA EKO, how did it come into the health insurance equation? Talk to us.
Well, when this Lagos State Health Scheme was passed into law, people didn't really know what it was all about. When they initially started, they were calling it Lagos State Health Scheme. But that was too long, and perhaps many people don't really understand what it is. So Lagos State government, through the board, gave us approval to have to call it ILERA EKO.
Okay.
And that is how the name came about. ILERA EKO is barely 1.5 years that we started, and I can tell you categorically that we have gone very far.
Right.
Because as at 1.5 years ago, people didn't really know what LASHMA or Lagos State Health Scheme really was all about. But as I speak to you now, we have been going around at the wide coverage as to what ILERA EKO means.
Right. In English, when you say ILERA EKO, what does it mean, really? For those who do not really understand.
ILERA EKO is also, you can call it Lagos State Health Scheme.
Okay.
Yes, for
just,
in English.
It just means something like health for all or something.
Health for us. Because
Okay.
our slogan is actually leaving no one behind.
All right.
That's our slogan.
So let's look at some of the products that you have under ILERA EKO. What are the products that we have?
We have the ILERA EKO individual plan. We have the ILERA EKO family plan. We have the ILERA EKO school plan. We have the ILERA EKO seniors plan. We also have the ILERA EKO tertiary plan, and of course, we have the EKO that's in charge of COVID-19 incidences in Lagos. Yes.
You mean COVID-19 is also covered under health insurance as well?
Yeah, the EKO handles that.
All right.
And EKO is a product of Lagos
LASHMA.
LASHMA, yes.
Wonderful. So let's look at all these plans that you've mentioned, and let's have a broader understanding You've mentioned different plans that are under ILERA EKO. So what are they, and how can we understand it much better?
The individual plan and the family plan, they are interwoven in the sense that they have the same benefits. What do I mean? Under the individual plan and the family plan, you cover a whole lot of treatments.
Okay.
For those who are still in the childbearing age. Pregnancy is covered, even antenatal is covered. Delivery with CS is covered. For those that are diabetic or hypertensive, it is covered. The routine drugs are given to them as at when due. For those that maybe want to go through minor surgeries like hernia, appendicitis, is all covered. And of course, asthma is also covered.
Okay.
We also have the dental services and eye services all on the scheme. For example now, for a woman that wants to give birth, sometimes it might be that she is at home or wherever she may be.
Right.
She may not have the opportunity of getting herself to the hospital. I'll give us some numbers here before I go that you can call, whereby an ambulance will come over to pick such a person.
Oh, that sounds pretty nice.
Yes, for the seniors plan, that one is an addition of what I've added. The benefit I just mentioned now.
Okay.
There's an addition to it for the seniors plan. That you can do mammogram on seniors plan. That is the screening and test of mammogram. That is the breast cancer.
Okay.
We're also talking about prostate cancer for the men. And of course, we can also do alcohol test. Alcohol test can be carried out. Likewise, X-ray and then general medical test can be carried out on them.
What do you call this plan again?
We call this seniors plan.
Seniors.
It's for 60 years and above.
And above, okay.
Like you said, we don't want to leave anybody
behind.
So there's no age limit. There's no age limit on ILERA EKO's plans.
All right. Then the next plan is what?
We also have the EKO that I've said before.
All right.
That one handles the cases of COVID-19 in Lagos State.
And then you talk about school. There's something for school plans?
Yes, we have the school plan.
Talk to us about it.
School plan, we have three times in the session in school. For each of for the school plan, we have their premium is 7,500 per session,
okay,
which is 2,500 per term, and of course they have access to all the services that I've just mentioned now. Definitely, they are not in the childbearing
age. Definitely.
So that one is out of it. But every other thing that I've mentioned for children
is covered.
Yes, it's covered. And we also have an addition to that. Okay. While they are on vacation, they still have access to the hospital that they have chosen.
Right. So all these plans have hospitals that are registered with them. Is that yes, what it means?
As I speak to you now, we have over 220 hospitals in Lagos State that are currently partnering with us. We have the general hospitals, we have the private hospitals, we also have the primary health care centers that are all onboarded on the scheme, on the ILERA EKO scheme.
All right. So before we switch gears to the next level now, let's mention the premiums that are attached to all of them. Of course, you said 7,500 for the school plan. What about the family and the individual plan? How much do I need to pay?
For the individual plan, per annum is 8,500. For the seniors plan, per annum is 34,000. But if grandpa and grandma want to do it together, we have a discount of 3,000 for them.
Okay.
Which makes it 65,000 as against 68,000, because we said it's 34 per person.
Right.
But because they are seniors, citizens of the country and of Lagos State, we give them a discount, so it's 65,000. For the family plan, it's 40,000.
Okay.
That one has to do with the father, who is the principal, the spouse, and 4 biological children that are no more than 23 years. It will interest you that before now, if I had been on this program maybe sometime in November, I would have been telling you 18 years.
Right.
But with the approval of Mr. Governor, that is Babajide Sanwo-Olu, he gave us the approval to the board that we should increase the number. But if you look at it, so many people are giving us feedback that even at 18 years, they are still feeding their children. Their children are still living under their roof.
Right.
And they came out and told us that, why can't you people increase the age limit for this family plan? So we got the approval to the governor and to the board. And our able and hardworking GM, Dr. Manazamba, also had a say in this. And we are given approval to add 5 years to the number of years, which was a total of 23 years now.
Right.
So they have access to care under the family, under the parents from the age of from 23 years and below.
All right. So this means that any child that falls within that age will be able to get access, provided there are 4 of them, right?
Yes.
So
In addition, sorry to cut you short. In addition, we also have what we call pay small. Yes. For the individual plan, it is 1,000 naira per month. For the individual plan.
all right.
Yeah. For the family plan, it is 3,500 per month for the family plan.
Okay, so you can be paying that all through the year.
You can be paying that all through the year.
Ah.
And that is where we'll be talking about the promo and the rewards.
Very, very shortly, we'll do that. But for adventure, I have more than 1 wife and I have more than 4 children. What's the...
Okay, good. If you have more than 1 wife, like we said, it is universal health coverage. And Lagos State, through ILERA EKO, is leaving no one behind. For that reason, if you have more than 1 wife, you have the opportunity of adding your wife, but it will just cost you an extra fee of 8,500 to add your wife. For your children that are below the 23 years of age, it is 6,000. For your children that are above 23 years of age, it is still the 8,500.
Okay.
Yes.
So it's not much beyond that at all.
No, it's not much beyond that.
All right. Lagos Traffic Radio 96.1 FM. YourSidMirror is the program, and I have with me in the studio this beautiful morning, I have Olukayode Ogunbayo. He's the sales manager for Lagos State Health Management Agency, LASHMA. We're talking health insurance this morning, basically making reference to the ILERA EKO and, of course, the different products that we have under this particular program. All right, then we'll take you through the roads. We did tell you that Third Milan Bridge still looks good, especially from the entry point. And proceeding towards Adekunle and Adeniji, you have high influx there, but no major worries if you're driving through that corridor. Return journey as well looks pretty good. We did talk about the breakdown of the articulated vehicle at Fadeyi inwards Anthony, but not much effect on traffic within that particular corridor. Mile 12 down to K2, all that corridor, it's receiving with good vehicular flow, even though it's high, but of course it's moving as well as you navigate through that end. Let's take you through the Mile 2 corridor. Motorists are currently experiencing slow movement departing Maza en route to Mile 2 underneath the bridge. This is not unconnected to movement at Mile 2 OK. Motorists will find it free departing Mile 2 underneath the bridge en route Signal Barracks to Suru. Now, on the reverse stretch, we can tell you traffic very much appreciable from Suru through Signal Barracks to Mile 2 underneath the bridge. That's what you'll find. Motorists are having it busy from Mile 2 en route Durbar Junction. This is due to the failed portions of the road within that particular location. No impediment cited, even as we speak right now. Let's take it through the Olowu and Obalende end. It's high influx, but slow and steady movement from Adekunle inwards Adeniji down to Simpson underneath the bridge. But ascending and descending Osborne Road, it looks good. Obalende Bridge, inwards CMS Bridge, down to Akpogbon by Ofi Canal, very much in good shape as well. And then the return journey immediately after Akpogbon Bridge, inwards CMS by Outer Marina. It's a busy one, down to Odulami. Manual alternation, very much in control by the Inner Marina and connecting Cathedral. But it's good from State House, Mekwen Bridge, inwards Bonny Camp, and of course Obalende Bridge down to Liberty Estate, connecting Kata Bridge. Looks good. And then it's faster movement from Adeniji inwards Adekunle on the return journey. No impediment cited, and the officers on ground doing the needful at the various choke points. Okay then, so let's move on. Let's talk about the ILERA EKO mega promo. What's that all about?
Okay, thank you, Mr. Presenter. Before we go further, I want to add what I've said before.
All right.
For the pay small, I said it's 1,000 naira per month. The senior for the family plan, I said it's 3,500.
All right.
But before you can start accessing care in the hospital, you must have paid for 3 months. E.g., you want to pay for family, 3,500 times 3, that's 10,500.
All right.
That's what you're going to be paying. Then for the individual plan, you are going to pay 3,000 upfront to start accessing care after the payment has been done.
All right.
Then for the quarterly med, apart from the COVID-19 services that we render, you can also be at the comfort of your house or your shop or your office and make a call across to us to get services rendered to you at home by our doctors. But in any case, maybe you need to be referred to hospital. That will be advised after the call. That attracts 3,000 naira per annum.
All right.
Yes.
So let's talk about the mega promo that you have on at the moment. What's that mega promo about?
Mega promo is all about, like I said, this is the season of giveaways. And it's also an opportunity for us to carry everybody along in Lagos because we do not want to leave anybody behind. Lagosians or residents of Lagos have the opportunity of winning Korope as the first prize, generator set as the second prize, and a TV set as the third prize. These prizes will be in all our 5 divisional offices. We have a divisional office in Ikorodu, we have in Badagry, we have in Ikeja, we have in Lagos Island, and we have in Epe. These prizes will be won in all the 5 divisions. How do I qualify to win?
That's the question. So what do I do to be part of this that will win?
You just need to pay for this prize is actually based on pay small.
Okay.
For you to qualify, you pay small.
You must be within that pay small.
So yes, we want to relieve people of hardship of paying full payment. So it's pay small. Like I said, by the time you pay 3,000, 5 times 3 for family, that is 10,000. You qualify for a raffle ticket. You qualify for a raffle ticket. Likewise, the second prize. Likewise, the third prize.
So when is this promo? When is this prize? When are they going to be unveiled?
They will be unveiled by the end of February. I have not finished.
Okay, go ahead.
You know that it's 2 in 1. We have the promotions and we have the reward, the referral.
Oh, okay.
For the first prize, if a family like you have paid the premium now, 10,500 to start off, and of course you have to pay the balance at the end of the day. So it's the quarterly payment that you can be making. If you can bring a family of 30, you can win up to 120,000 naira in cash.
If a family of 30
you can refer a family of 30.
Okay.
You have the opportunity of winning 120,000 naira cash prize.
Wow.
For the second prize, which is the generator, anybody that buys that ticket, that gets that raffle draw, if you refer 20 families, you also have the opportunity of winning 80,000 naira cash reward.
Okay.
For the third, if you can refer 15 families, you have the opportunity of winning 60,000 naira cash reward.
All right.
It has not ended. After this promo, it continues. If you can refer extra family, for every extra family you refer, you'll be getting 5,000 naira. For every individual that you refer, you'll be getting 2,000 naira, and it is for life.
For life?
Yes, as long as you are referring, you are getting the 5,000 naira, 2,000 naira.
Wow.
Yes.
So every referral that you send to Lashma to enroll under this scheme, you're going to be rewarded.
Yes, and to also add to that, we have what we call ILERA EKO Pay Small contribution card, which will be given to you so that it will be in two copies, one for the enrollment officer and one for the enrollee, so that you can be cross-checking how much I've paid so far, so that there will not be any along the line. We also have another one that is the ILERA EKO referral card. For those that will be referring, we have a card for you that you'll be entering so that there will be proper accountability and documentation.
All right. Lagos Traffic Radio 96.1 FM. Olukayode Ogunbayo is my guest this morning, sales manager for Lashma, and we're making reference to universal health coverage for Lagosians. ILERA EKO to the rescue. All right. You might want to ask him 1 or 2 questions. Feel free to connect with us if you know that you're very much interested in this scheme. This is an opportunity for you to win some great prizes too. So maybe you might just want to take advantage of that at the moment and win something. All right. But before then, quickly, do not forget, we have that breakdown at Police College immediately after customs. It's a broken down articulated vehicle, And the backlog, as of the last time we checked, was beyond Ikeja underneath the bridge. Dabo, what's the latest with it? Has it been fixed? You can keep us posted on that one. Airport road section, we can tell you traffic from NMPC inwards Keno looks good. Down to that's NMPC to Keno looks pretty good. From there to Chibita, connecting Lukman and Atuba Joan is slow. This is due to alternation. Osala Way from Aye inwards Aswani Market Junction looks free at the moment. Down to Afari Ogun Junction is also free, aside for alternation delays. Connecting 7 and 8 is slow due to alternation by Joy Avenue and Awoni Elemo Junction. At Jao Estate, it's a moving traffic being experienced there, coupled with alternation. No impediment cited. If you're driving through that corridor, all looks pretty well for now. 0809-912-0777 is the numbers that you can connect with us. If you have any questions for Ogunbayo, by the way, or perhaps you want to partake in the mega promo or some of the things that he has said, you might just want to react to it as well, feel free to connect with us on 08099120777. Hello there.
Hello, good morning.
Good morning.
Yeah, this is Ayo from Okpa.
Ayo, how are you doing?
I'm good.
All right, compliment of the season to you.
I wish you the best.
All right then. So what's your question or what's your inquiry?
Yeah, I just want to advise that all this stuff is a very good initiative, but I think they should simplify it. For the last 6 months, I've been making inquiry how to make payments and all that. They will tell me they are in one market, they are in one local government or LCD or one general hospital. My advice is this: they should just simplify it. Have an app where you can access the information, where you can make payments, anything you want to do. It should be on mobile phone, where you can do all. In fact, I have 4 of my friends that they are ready to do it. But for us to go to one local government or general hospital or stuff, you know how this thing works in Nigeria. It's an added stress.
Right.
For us, we are always on the go. So just give us the help that we can use. Thank you.
All right then, Ayo, thank you so much for that one. So do you guys have plans for that, Olukayode?
Yes, we have our website that they can register with on www.lashma.com. They can actually do self-registration and make payment. Yes. And further to that, I want to quickly call our call center numbers. They can also call in, and we can do the registration for them from the office without them even coming to our office. We have been doing that. The numbers they can call is 0700 ILERA EKO, 0700 ILERA EKO, which means 0700 453 72356. One more time, 0700 453 72356.
Okay.
The second one is 0800 Ask Lashma. 0800 Ask Lashma, which simply means 0800 2755 27462. One more time, 0800 2755 27462.
All right.
We also have our WhatsApp number, 070 453 58275. One more time, WhatsApp number, ILERA EKO, 070 453 58275.
All right, then. Lagos Traffic Radio, 96.1 FM. Lagos Ibadan Expressway still looks pretty good inwards Lagos, but watch out for slowness around areas like Loto, Asheshe, Deeper Life Camp. Of course, this is all due to high influx with narrowed lanes and construction around those areas. Nothing untowards. Motorists are advised to continue to obey the traffic rules and drive within specified limit at the moment. All right, then 08099120777 and 09153877127. Numbers that you can call to make your inquiries, or perhaps if you want to connect with Olukayode Ogunbayo this morning, to find out one or two things that relates to the program, feel free to connect with us. All right, so for those who want to tap into this now, apart from the fact that you can make payment even via the website, where are your offices located? How can people cite you guys so that they can get more information from you?
Okay, thank you. Our head office is at number 17, Cafe Street, Alausa, Ikeja, at the back of ShopRite. We're in the same building with Wema Bank. One more time, head office is at number 17, Cafe Street, Alausa, Ikeja, back of ShopRite.
Okay.
We have our divisional offices in Ikeja, Ikorodu, Lagos, Epe, and Badagry. The Ikeja divisional office is inside Ikotun Igondo LCDA Secretariat.
Let's see if I can take this call. Hello there, good morning.
Good morning, Victor.
All right, who am I speaking with?
Compliment of the season.
Same to you.
This is Mrs. Lawal from Ikorodu.
Oh, nice to have you join us, Mrs. Lawal.
Yes, thank you for this program today. It's an opportunity for me to express my mind.
Okay.
The first thing is that the state has no program for pensioners.
Why do you say that?
Go there and you have to pay like any other person. And having done that, I now went for treatments, eye treatments, and I have to pay every damn cover. They said that it doesn't cover eye treatments.
Okay.
So a pensioner who managed to pay this money, and I still have to go there, straight, and I have to pay everything. It's not good enough. It's not good enough. It's not that the state has a program for us, but we are not included. I need to get there, and I've registered for almost 9 months now. I didn't use it. When there, I have to pay everything. Initially, I was asked to replace my card with a smart card they are using now. I pay for that. I got to the eye clinic. I started paying everything, including the drugs. So, I don't know. For somebody who doesn't have hypertension, don't have diabetes, don't have any other thing, the only element I go there for, I have to pay.
Is the eye
I think
treatment.
this needs to be addressed.
Right.
Thank you, Victor.
All right, then. Thank you very much, Mrs. Lawal. So what would you say to that? Does it mean that the scheme doesn't cover treatments like eye treatment?
The scheme covers eye treatment. The only thing we don't cover for now is we don't give glasses. But I'm happy to announce to you here this morning that glasses from first quarter of 2022 has been approved
All right.
to be given.
All right. So, Mr. Kayode, is there a disconnect between what the program is and what obtains in the hospitals? Because this is not the first time we're having this kind of complaint. But by the time you get to some of these hospitals, despite the fact that you have all this coverage that you've mentioned now, some hospitals will tell you it's not there. There are no drugs. You have to purchase those things by yourself. Why is it like that?
Essentially, there's no disconnect. The only issue that we may have is, for example, many hospitals, we actually train the employees of these hospitals, including the MD of the hospital. But at many times, when we go there to do our own music shopping, we discover that 1 or 2 or 3 people that we have trained are no longer in that hospital. So what I'm trying to say is that employees go and come. We have trained a set of people now. By the time our enrollees go there for treatment, another person is there. That person has not been carried along. The person doesn't even know what ILERA EKO is all about.
Yeah, but
so we have been doing
your sensitization.
Yes,
right?
for them on regular basis. We have our quality assurance officers that go there to give them briefing, to educate them. That is for, I'm not talking about the hospital's staff now.
Right.
Yeah.
So, but there should be a kind of penalty. Let's look at Mrs. Lawal's case, for instance. She had to go there. She made all the payment. And you're saying now that eye treatment is part of the coverage.
Yes, now.
So what happens to that kind of hospital?
I will advise Mrs. Lawal, right? I will advise her that whenever she goes to those hospitals, she should call any of the call center numbers I've called. From experience, when you go to the hospital and you don't call us from there, you get back to the house. By the time you get back to the house and you call us, the hospital will deny that nothing of such happened to them. If Mrs. Lawal go to the hospital today and she says she wants to see a doctor for one ailment or the other, and they're telling her to pay money from her pocket, it is a right as an enrollee under ILERA EKO to call these numbers, and you see there will be changes. where they will be collecting money from her, henceforth, they will not be able to collect money again.
All right, let's take more calls right now. Lagos Traffic Radio, 96.1 FM. Hello there. Good morning. Hello.
Hello.
Good morning.
Good morning. This is Angela calling from Isheri Agodo.
All right, Angela.
I just want to tell them to ensure that the coverage is known by all. I mean, it's not something that should be kept in secret. Everyone should have access to the coverage list. So when you go to the hospital, immediately nobody can bamboozle you and tell you one story or another. It's there. The coverage list is there as a patient. Every patient should have a coverage list. So when I go to the hospital, I know beforehand this is what it's covering, and it's not black and everything is black and white. I don't have to second guess. Or someone does not need to tell me this is not there or that is not there.
Right.
So every patient, as part of your package, once you enroll, should be given a list of what the coverage and what it covers.
Right.
And I'm not saying that works well, because access to information, once people don't have access to information, there's opportunity for misinformation.
Right.
So once information is available, then it helps a lot. It helps a lot.
Very good. Very good. Thank you very much, Angela, for that concern. So what are you doing to ensure that people have this comprehensive list?
That is why we are here. We are going sanitizing Lagos residents and visiting radios to talk to them. As I speak to you now, if Madam goes to our website, she has access to our list of hospitals and the benefit package. For the benefit of those that did not listen to me initially when I mentioned our website, I will say it again. Our website is www.lashma.com. Lashma is LASHMA. www.lashma.com.
Yes, but she's also saying that can't you have a physical copy there so that when you get to those hospitals, they bring it out, we all see. Okay.
We have that. We have that.
You have that in the hospital.
What we want to do now is I want to have a roll-up banner.
Okay. That will show.
Yes, that is what. In fact, that one we kick off first quarter of next year.
Good.
We are going to have a list of benefit package on roll-up banner that will be at the entrance
of each
hospital by the reception.
What about the issue of drugs? Because also we have these hospitals trying to play some hanky-pankies. They'll tell you that this drug is not available. Once it's not the pain relievers, nothing else is provided.
Well, in the case of drugs, I will not tell you that it's not happening. It is happening. But like I said before, these numbers that I've given out has been a saving grace
for so many.
All
right.
Yes.
Let's quickly give the numbers now as we wrap up things on the program. What are the numbers that they can call if they have any infractions with any of the hospitals?
Once again, 070 ILERA EKO, 0700 453 72356. That is 0070 ILERA EKO. 0800 Ask Lashma. 0800 2755 27462.
Right.
Those are the numbers they can call. And of course, I want to quickly share with us the numbers we can also call for the ILERA EKO promo and reward.
Yeah, quickly.
Kennedy 080 3538 0317. One more time, 080 3538 0317. Kennedy. Shagun can be reached on 081 6901 8853. Bolu can also be reached on 081 630 58338.
All right, then we have to leave it at that for now. It's nice having you in the building this morning, Olukayode, Ogunbayo. Thank you so much for being here.
Thank you very much, Mr. Victor.
All right, so I wish Lagosians the best of this mega promo. Quickly, what's your message to them as relates to this mega promo? And you said it's coming up, the draws will be coming up when? February?
The draws will be coming up in February.
All right, so
at the moment, we are visiting all the local governments. And at each local government, we also do a raffle draw where people can win a bag of rice, 50 kg and 25 kg in two places.
All right.
With vegetable oils.
All right. Am I allowed to partake as well?
Of course, you are allowed.
All right, then.
As a matter of fact, all civil servants automatically
qualify.
Okay,
then. We'll leave it at that for now. Thank you so much for being here.
Thank you very much.
Okay, so I have with me in the studio Olukayode Ogunbayo, who is the sales manager for the Lagos State Health Insurance. That's the Lagos State Health Management Agency, Lashma. We have to go. The program this morning has been produced by Korede Bamishile. Maximum thanks to Adeyinka Gbemigbade, who is the public affairs officer for Lashma, working tirelessly behind the scene. For more visibility for Lashma, I will say a big thank you to you. Our social media team, thank you to Okpayemi Shudunke, not forgetting our executive producer, Tayo Akonle. Tomorrow, YourSidMirror will return, but till then, this is Victor Oteri. I'm wishing you well. Bye.